I'm Dr. Nilesh Shah. I'm the medical director for Summa Health Sports Medicine. I've been running for over 30 years. I ran at Case Western Reserve University, where I ran cross country and track. My events in track were the 3,000 meter steeplechase and the 5,000 meters, and I've run over 15 marathons. So my first marathon experience, I was just out of college, off my college track season, first year of medical school. I was looking for some kind of running goal for myself since I wasn't running as part of a team anymore. So I figured the Columbus Marathon might be a good idea. It's a great marathon, it's a fast marathon, so I thought I could probably do pretty well for myself. So I had a time goal in mind, and I had a pace in mind, and I started off pretty much on pace for the first couple of miles, and then next thing I knew I was going a little too fast. But I felt good. I got probably caught up and my adrenaline was going, but I felt great, so I just kept at it. So I went by my first 10 miles in 58 minutes, probably about 3 or 4 minutes faster than I wanted to go, but I was feeling great, so I kept at it. Next 10 miles goes by, another 58 minutes. By that time, I was not feeling so good, but I was still keeping it together, and then within another mile or two, everything shut down, hit the wall. My calves were cramping, my quads were cramping, my hamstrings were cramping. Pretty much walked and jogged the rest of the way. Probably maybe crawled the rest of the way is probably a better way to put it. I think looking back, a couple of mistakes that I made, I didn't work my plan. I had a certain plan in mind. Maybe for my first marathon, I should have had a time goal in mind, because that's now what I counsel my patients on doing, is not have a time goal in mind for your first marathon. But I did, and I didn't even work my plan, even though I had a time goal in mind. I was going way too fast. I also wasn't drinking like I should. I drank like I would for a 10K. I wasn't prepared for the distance. Took a sip, dumped the rest on my head. I wasn't thinking about that. I didn't have any energy to put back in my body. Didn't have a lot of energies and gels and goos back then, but I could have had something to replenish myself with. So I think a couple of mistakes I made that looking back now that I could have probably changed was, one, not have a time goal for myself for my first marathon. Two, making sure I worked my plan if I did have a time goal and not vary from my plan. And three, making sure I kept track of my water intake and my energy intake during the race.